Can you tell us a little bit about yourself?
Yeah. Thanks for having me here today. My name is, and I've recently graduated from. My passion for nursing actually really began at a very young age. My grandpa had type 1 diabetes, so staying home with him all the time as my parents were at work, I was really the one that was like watching him, like his blood sugars, helping him, giving his insulin at the proper times. So that actually really gave me what it felt like to deliver patient-centered care. And I really saw the positive impact that left on my grandpa. So that really kind of dug me forward into the healthcare space overall. And as I tried to look at different healthcare outlets, I was taking my pre-nursing requisites at the time, and I found myself really enjoying physiology and anatomy, and really combining that passion with my passion for patient-centered care. I found that this was the ultimate hybrid for me to really lock in into the field of nursing. Currently, right now, I'm part of the Care Partner Full Flow team. So I'm really blessed to just be exposed to such a diverse population there. And it really allows me to become adaptable to the care I provide and really adapt and deliver compassionate care through. Outside of, I actually work as a surgical nursing assistant at and doing my internship at the same time for where it really just allows me to become exposed within the OR workflow and really solidified my genuine passion for the OR. Ultimately, I'm just really excited to leverage my skills that I've gained throughout my nursing journey, such as being a hard worker, really being attentive to detail, being able to work in such a fast-paced environment to make such a positive contribution.
I really like it. Slow down a little bit, let yourself breathe and like be comfortable. Because if you
Okay.
feel like amped up, they'll feel like not at ease, you know what I mean?
Okay, for sure.
The impression that it's giving is, obviously that you've rehearsed this,
Right.
but it almost made it sound too rehearsed. And I was
Oh,
listening, it it was just a couple like super formal words that you wouldn't use for sure if you were just talking to me. You know
okay,
what I
for
mean?
sure. I maybe if like at the end of the video, I'll like look at it again
Yeah,
and
yeah,
see what
yeah.
formal word was.
It kind of goes without saying, most people have said this introduction a few times. So
Yeah.
it's not the end of the world if this part sounds a little bit rehearsed. It shows that you're prepared, but I feel like it would seem more like you were just getting to know them if you slowed down a little bit and then there were just
Okay.
like a few, like I said, just a few transition words. But overall, yeah, we usually this takes 20 minutes to get to
Oh,
the
okay.
point, so we're doing
Um,
good. Tell us about a time you had a difficult patient. And it's not necessarily the most difficult patient you've ever had. It's usually the story that lets you tell them the before and after and how you were able to de-escalate.
we had a patient, he came in with, and me and my nurse were assigned to help clear his wounds that he had all over his face because they had a lot of bloody discharge on there, and we just wanted to provide him a better stay at this hospital. And as we came in, the nurse beforehand told us that he was being a little bit difficult. He was agitated. So we kept that in mind. So as I entered this room, I really just start off just trying to introduce myself to the patient. I just didn't want to walk in there and make him feel scared of like, well, like who are these two people just coming in at like 6 in the morning? So I tried to introduce myself and I noticed that he was really agitated. And I was like, hey, my name's and I'm gonna be your care partner. And this is my nurse. We just wanted to help clean up your wounds. And he immediately said, no, like, don't. I really don't want to do this right now. And I was just trying to adapt that we have at work, which is to really just create such a warmth environment for our patient. And I asked him, is there something that we can do to help you feel better, or let's make your stay enjoyable at this time? And he really said, like, I enjoy listening to Elvis. So I asked my nurse if that was okay if we just played some Elvis on the computer while we help clean his skin. And immediately, 2 minutes into the song playing, I just noticed a shift in his mood, and he was definitely more compliant. And that really allowed us to open up another boundary where he kind of trusted us more and he kind of opened up to us. And it was really nice that at the end of the day, he was more of someone that, it's easier to talk to. And yeah, like at the end of the day, like I feel like he was more of a friend to me than just a stranger like 12 hours ago.
Okay, just a couple nitpicky notes. Don't imitate his voice when you say what he says.
Oh, okay.
It was slight, but it was there. And
Yeah,
then
I noticed that and I had to stop myself for a second. Yeah, I was like, oh
it
no.
it makes the story better, but you can't do it in an interview.
Yeah, I totally get it.
I thought it'd be kind of cool if just to make them picture it more, was there a specific song that they would have heard of that he liked?
Yeah, I think it was Hellhound. Like something Hound. I had to look it up again, but I'm not really a Elvis listener, but I just remembered like something Hound, and I can't. That's the only thing I remember. But I can probably look it up tonight.
Yeah, yeah, yeah. Okay. And then I'm trying to think of something you could say at the end to bridge it forward to all the situations. Maybe you could talk about how it taught you that when you have a patient that you get in report is difficult, that you like to just ask questions about how their experience has been and get to know what's been concerning for them. And for this patient, you could tell that, and I don't know what from what specifically he said, but maybe you could say you could tell that he was scared because he didn't know what to expect, that people would just come in his room early in the morning and do things without explaining them to him. And it was putting him on guard. And you were glad that he was able to open up and tell you about something that you could do to make this experience less scary for him. And it was actually enjoyable for him to give him a more positive experience in the healthcare setting, and then have him actually be able to receive the care that's going to help him progress
Mhm.
instead of refuse it.
So like at the end, just like restate like what I learned from that
Yeah.
scenario. Okay.
Yeah, something that, because like, let's say there's another patient and they are upset about something like completely opposite.
Mhm.
Maybe it's that their nurses are explaining too much and it's annoying and they just want them to do it and get out. Like, who knows? Like everyone, I mean, don't say that, but everyone kind of has their own thing that is their pet peeve that their nurse might do. Um,
Okay,
yeah.
definitely.
I've gotten a lot of great feedback from you guys about the questions list with the 72 questions. You guys can get that for $3, by the way, with your discount code YouTube. And I wanted to build something for you where you can build out your answers on your phone that's really easily accessible. There's 33 of the most common questions that I put into a Notion template. If you don't use Notion yet, you should check it out. It's a really cool app similar to the Notes app, but it's very customizable. You can add pictures to it, you can change the colors, make it look how you want it. For each question, you get guidance on things to include, things to avoid talking about, example answers, and then there's embedded YouTube videos where you can watch other new grads give their example answers. And there's a notes section where you can type into and save your draft of your answer and start building your answers when you're waiting for the bus, or you're waiting for post conference to start, or you're in the kitchen cooking pasta and waiting for the water to boil, or just whenever something comes to you, you can just put it right in your phone in a way that's super easy to go through. You can also use the Notion app on your computer browser, you can use it on a tablet, but I wanted something for you where you can just little bit by little bit, or over the course of a night, if you have an interview tomorrow, start building out your answers in a way that's easy to break down with a lot of examples to help jog your memory for examples from your clinicals that you may have forgotten about. This is just a very streamlined way to start throwing in ideas and how to build out your answer in a way that's going to be very easily accessible on your phone.
What if they ask like the family version of this? Like, tell me about a time you had a family member who was unhappy with your care and how you turned the situation around.
So if there was a family member, I would first try to,
Would you
uh,
have like a situation though where a family member was
yeah, it was during my rotation at school. They're my clinical rotations.
yeah.
I had this patient where the mom just didn't really feel comfortable with the nursing student doing the nightly, because we were night shift. So then the mom didn't really feel comfortable that a student nurse was caring for this newborn baby. And I first I came up to her and I introduced myself like, "Hi, my name is and I'm the student nurse for today. And if there's any concerns, like just please let me know, and I'd be happy to assist you in any way possible." And I immediately told her that I'm here to just to check her routinely vitals before like it was the night started so she could rest for a little bit. And I'm gonna be honest, like that was probably my first time ever trying to start the vitals on a baby, and I never expected like the baby to start crying everywhere. And I think that that moment, the mother just thought that I wasn't really skilled at the time, and she just was honing over me and just didn't really feel like she wasn't comfortable with me touching her baby. And it was totally, I totally understand. And I asked her, like, is me caring for this baby, like, is this causing concern for you? And she's like, honestly, like, with no due respect, I just don't feel comfortable with you caring for my newborn right now. And she asked if I can bring in a nurse in this scenario. And from what I learned from this scenario is that, before I just actually start initiating like my actions, I would rather just tell her what I'm going to do. And if there's any concern she has, like I can, address it right away before I accidentally touch the baby. And because then she ended up crying a lot. And I think that caused the mom to have like some sort of anxiety around me.
You answered the question, but like I don't know that it necessarily does much for showcasing you. You know what I mean?
Okay.
It,
Yeah.
it's cool if it's, you turn it around with some sort of like education that like helped build the trust and build the rapport, or like, sometimes people talk about, like I was editing a video on the plane about this girl who was talking about how she saw a family member in the hallway who was upset because, and it wasn't her patient, but the family member was upset because their mom had been sitting in urine for 20 minutes. So she um, helped them. And then she talked about, saying like, thanks for bringing this to my attention. I'll be around if you need anything, so sorry again. Like, or people talk about, if they had to do wound care maybe, and they say, oh, I don't want the student nurse. And then they start educating on all the pieces of it. And then they kind of warm up to them.
Okay. Think of it now. I think I did have one. Actually, during my basically what had happened was the mom was the patient and the daughter was just like the visitor. She noticed that her mom had some sort of rash underneath her diaper around like the diaper area. So then
But just say in her groin.
yeah, in her groin.
Yeah.
And I noticed, and at the time, I wasn't the nurse. I wasn't the student nurse for this patient, but the way this hospital was, it was a two bed. So it was like one room and then like a curtain on the other side. And since my patient was on one side, I asked the daughter, like, is everything okay? I noticed that you were kind of upset. Is there anything I could do to help? And she said she noticed that her mom had some rash around her groin area, and she's been telling the nurses that's really painful, but I guess the nurses really haven't been paying attention to her. So I called my nurse because my nurse was right outside the door, and I said, hey, this patient here, I noticed that she has like some scars or rashes around the groin area, and she's been saying she's in pain. And afterwards, the nurse noticed that it was like a serious rash. So contacted the doctor and tried to take initiative action to help alleviate this from further progressing. And I think at the end, the daughter really thanks me for just trying, even hearing her out and noticing before quick to judging. And at the end, I educated her that sometimes these rashes could happen from like if the diaper hasn't been changed for a while, or if there's urine that wasn't cleaned properly, and that could happen as well. So at the end, like I was able to educate her on why these rashes happen, and I was able to build rapport with her, tell her that if there's any more concerns, I'm going to be here for the next 12 hours, so you feel free to let me know if you need anything else.
Okay, yeah, I like this one way better. I don't want it to sound like you and your nurse went straight to the doctor instead of talking to her first. So maybe say you brought it up to the nurse, you asked if it would be easier or if she'd like you're happy to page the doctor for her.
Okay.
Uh, and she said that would be really helpful.
Okay.
Because then it sounds like you're being a team player rather than like swooping because you thought she was incompetent or something. You know what I mean?
Okay. So, um, before like, but so letting the nurse know, and then page like asking her if you would like me to page a doctor for you since you're busy right now. That's
Yeah, yeah, yeah.
oh yeah. Okay.
And then so typically what happens with these groin rashes, it's usually like in the creases, and it's
Yeah.
because the moisture just sits there, and
Yeah.
the moisture kind of breaks the skin down. And then often what happens is like fungal growth makes it worse, you know what I mean?
Yeah,
So
yeah.
typically what they'll order for that is, I don't know if you've seen them do nystatin powder, the like white
Yeah,
powder.
I've seen the dry white powder. Yeah.
Did they do something like that, or like zinc paste, or what did they do to treat it?
Um,
Like trim?
I unfortunately like I wasn't there to see it, so I
Okay.
had to go on lunch after, and when I
Oh,
came back, the nurse was like, "Oh, we finished it. Like, don't worry about it."
okay. Okay. Maybe you can say that if you want. It doesn't matter if you do or don't. What I see a lot of people do is they'll say, and I told her we're doing the best that we can, which feels very like, ma'am. You know what I mean?
Yeah,
Uh,
totally. Yeah, yeah. That's what I'm
like,
getting.
yeah. But you didn't do any of that, which was good. Yeah, just, say whatever you said to her, something that has the vibe of like, that's really helpful that you let us know. Thank you so much. We really appreciate it. Something where she's like, okay, I did good, you know,
Totally. Okay.
versus like that nurse hates me. No one listens.
Yeah.
You know what I mean?
Yeah,
Um,
it's some bad news. She doesn't want to listen to me. Yeah, I get it.
okay, cool.
Yeah, I actually have one, and I think one of your videos, someone had something very similar to me, which I thought was kind of cool. So for me, as for a certain sense, I think when I went above and beyond for a patient was during my rotation at school, and this patient, he really seemed distraught, like he really seemed sad. And when I looked into him, I asked him like, was everything okay? And I quickly introduced myself. Like I kind of read up on his chart a little bit before I went in there, and he was just here for I think something was wrong with his abdomen. I think he was lots and he had a lot of abdomen pain. So I asked him, is there anything wrong? Can I do anything to help? And he just really wasn't talking as much. He was nodding here and there. And one thing I noticed was that he had like a picture of his son like on his like like the little tables that they have on the hospitals in the hospitals. And I was trying to make conversation with him, and I was like, "Hey, is that your son?" And then I think at that moment I kind of saw him like open up his eyes and try to talk to me more. And he was like he was saying, "Yeah, that's my son." Like, yesterday was his 22nd birthday. And I was like, oh, so it was your son's birthday. Like, I was like, oh, was it recently your son's birthday? He's like, yeah, but he's with his friends right now traveling across the states. I was like, would you want to see if we can call your son to see if you can wish him a happy birthday or something? Because I think his son wasn't able to talk to him for a couple of days due to like travel. So what we did was I took this situation to my nurse and I was like, hey, I think this patient's kind of like sad right now. I think it has to do with something with his son. And I showed her that picture that I was talking about. And we actually went through like the registration on the chart, and we saw that his son's number was actually listed on there. And what we did was we used the hospital phone to like try to call him, and we're like, hey, we're calling from this hospital, and your dad wants to talk to you about something and want to wish you happy birthday. And eventually we were able to FaceTime him on on our patient's phone. And I think at that moment his mood went up so much better, and he really thanked me for just noticing that, because he thought that he wasn't going to be able to call his son at all, just because he didn't know if he was allowed to use a phone here because it was his first time at the hospital. And I told him, you're allowed to call anyone here, and if you want to talk to your family members, you can either let us know, or if you have anyone else you want to talk to, we're more than happy to help. And I think from that moment, I just realized that just noticing the small details, something that can be easily overlooked, can really help you strengthen your relationship with your patient and just create an environment where they feel welcome, I think.
I love the last like the wrap up for that. I'm trying to remember your wording so I can like use it for the future. The part that was confusing for me was like, wait, so he have his own phone that he could have used, but he didn't want to bother his son, or like his phone was dead, maybe, or like
Yes. So
what?
what happened was his phone, like it was I think it was, yeah, it was dead actually. And he didn't have a charger. So
Mm.
luckily the computers that we're using, it was connected to an iPad, and it was the same charger for his phone.
Oh,
So I charged his phone, and then at that point we checked the numbers on the computer and they matched perfectly with his son's number. So we were able to call him on his phone. And I think when he came in overnight, admission, I think his phone had died and he didn't bring a
yeah,
charger. So that's what happened. And I
yeah.
guess it's more bummed out that he wasn't able to spend it with his kids. He wasn't able to talk to his son about his birthday.
If you want to download my list of 72 new grad nursing interview questions, that PDF is linked in the description. Don't pay full price for it as a supporter of the channel. If you use the discount code YouTube, it's only $3. I made it all cute and aesthetic for you guys. It's 22 pages. The idea is hopefully interview day won't be the first day that you encounter whatever question they ask you. I've included every interview question I've ever heard of that any new grad has ever been asked. Don't pay full price for it. As someone who supports the channel, you get it for only $3. Just use the discount code YouTube.
Another thing I was thinking about, kind of unrelated, I know you talked about, like, because it seems like you've been wanting OR for a while if you got like the internships in the surgical stuff.
Yeah. Uh-huh.
Did we talk about why you want OR? Like, what about OR is interesting to you?
Oh yeah. I don't think that question had been asked yet, so I was just waiting for that. Should I talk about YOR in my tongue about
Well, like,
myself or
yeah, well, let's hear your answer and then let's see if, because sometimes people will say, like, well, should I talk about why I want to work in this hospital? Because what if they ask that as a separate question? Or like, why do I want to be a NICU nurse as a second, like, separate question? Like, say something that is enough for your introduction, but then have extra to go into if they ask a separate question so it's not awkward.
Okay, for me, I think it's explained better if it was talked about in a story. But for me, it was during my rotation we had a patient, he came in with a on his left upper rib. So we had to do like an emergency thoracotomy to help. He had impaired circulation basically from that wound. So we had to do emergency trauma surgery. And luckily at the time, I've never seen a surgery before. So I kind of asked the nurse if it was possible for me to observe the surgery because I think it's like a one-time thing that I get to witness throughout my clinical rotation. And luckily, the surgeon allowed me to come in and just observe the surgery. So when I went in there, I was actually really astonished by the agility of the OR team and how everyone at that specific moment was able to work collaboratively well in such a high pressure, high stakes, and just a fast-paced environment. And that's something that I feel like not many you get to see in many different units across the hospital. And if I'm going to be honest with you, I was really scared for my patient because I honestly never saw such a trauma like that before. And as I saw like the surgeon make his incision to help repair the circulation, I really felt chills. I was like, wow, like this is actually really happening right now. And I think at that moment, it wasn't like a scary chills. It was more like I'm very excited chills. Like I'm really excited to see something like this happen. And that's when I knew this is where I really want to be. I know I can thrive in an environment where there's such high pressure and everyone working together collaboratively. Because when I was seeing this, I noticed some notable traits that I feel like I resemble with myself. Really being able to communicate clearly when there's something needs to be done, working together as a team, being great attentive to detail, and overall working through this trauma together as a team. And I feel like at this unit, I don't really see this embodiment of teamwork at any other unit besides the OR. And that's when I realized that this environment's for me.
Okay. I like it as a separate answer. I'm trying to think how we can do like a shortened version for your introduction. So I would think it would make the most sense to fit it where you were talking about the different internships and stuff that you've sought. And then
Mhm.
maybe say, just kind of explain that the reason that you are so interested in the OR is because you had a patient once who needed emergency surgery that you were allowed to go observe. And I liked the part where it started with you talking about like the agility of the team and the teamwork and the collaboration. And then maybe I would go right into, I wouldn't go as much into like the being scared and the chills and the excitement and all that kind of thing. I would go straight into the traits that you saw in the team were
Mhm.
things that you really connected with,
Mhm.
specifically the communication, the clear communication and the teamwork, and that you haven't
Working under pressure.
working under pressure. Yeah, and that you haven't seen that to that degree on any other unit, which
Mhm.
is why you have been seeking out opportunities that were similar. Uh,
Mhm.
and then maybe just say like that you've really enjoyed working in I forget what they were, but Did that feel maybe like like I feel like the highlights were the the traits basically, like the two different ways that you talked about the traits.
Yeah, so in my Telling About Myself, like where I talk about at the same time, I work as a surgical nursing assistant at and doing my internship at this hospital at the same time, and then bring in what you just said into there, basically, like
Yeah,
high.
it's basically just the parts of what you said. So the part where you were talking, and I would shorten just because it's hard to fit like a whole story into your about me. Just say I had a patient who, in one of my clinicals, who ended up needing emergency surgery to restore circulation, and
Mm,
I was allowed to observe.
mm,
And it was the first time I had been in an OR, and then the bit that you talked about like the agility of the team, and I forget exactly what you said right after that, but that little chunk about the things that you liked that you really connected with. And then I liked the part where you were saying that they had a lot of traits that you, I forget what you said, resonated with or you connected with.
resonated with me. Yeah. Um,
um, and you were talking about the really clear communication and the being able to work under pressure very in a very coordinated way as a team. And you haven't seen that to that degree in any other unit, which is why you have sought out opportunities in the surgery. I can't, sorry,
Outpatient surgery. Yeah, at the outpatient surgery. Yeah.
the surgery center. And it's been a really great experience being
Mm.
able to delve more into those characteristics of nursing. Or you want them to be like, oh, so this guy is an OR guy, whether it's here or somewhere else. Like, this is where he thrives. Got it.
Oh, okay.
Like,
So
you
like,
kind of want to
yeah.
peg yourself as like, you need to be in the OR.
Okay, okay, gotcha.
Unless, is this interview for other units as well?
No, it's a panel interview with the unit director and the unit manager
Of
for
just OR.
of the
Okay,
OR. Yeah.
so yeah, go for it. Okay, cool. It was just like a side thought that I was like, we
Oh
didn't,
yeah, that makes more sense because
I
I
know there's something
always
else in there.
yeah I like wanted to talk about the OR in my time. I just didn't want to go too in depth because like you said, like I was just like, what if they're gonna ask me more about why I want to do OR and then like in
Yeah,
future. So I don't know if I should
they
be
might.
worried. Yeah.
Yeah. And then, I would maybe just talk a little bit more about the story of and like what you saw, or like if there was a specific way that they communicated that you respect.
Yeah, it was more like it was crazy to see how the scrub nurses they kind of anticipated what the surgeon needed at this
Oh, I like
because
that too. Fitting to me.
I remember like the scrub nurse told the circulator nurse I need this, and even before the surgeon said it, she already had it in her hand, and it was like, whoa, like how did you know like exactly what you needed? I think to me as like because I think nursing we never really were learned about surgeries. So when the scrub nurse was able to anticipate that, that was the skill like I really want to have. I feel like that's such a cool skill to have. So I thought that was one notable thing I thought was cool with the OR.
I think it might be helpful to throw in just like in your list of qualities, being able to anticipate the needs of the team.
Okay.
Yeah. Because it is almost kind of like a dance. It's like they work together
Mhm.
so often on the same things that it's like they already kind of know. I know
They're
what
like
you
independent, but at the same time, they're like teamwork at the same time. It's like,
Yeah.
and it's independent as like
Totally.
I know what I'm doing for like myself to make a good contribution, but I have to communicate as a team if I need something else. So
Yeah.
it's like one of those cool specialties you see in that unit. I don't really see at others.
Yeah. That's true. It's almost kind of like in a code too. It's like everyone has their role.
Yeah, yeah,
Yeah.
exactly.
Yeah. Do you have one for family-centered care? It'd be kind of a weird question to ask in the OR, but I feel like we should have it just in case they go off mm, you know, the
This
same
one's
questions for every unit.
so this one's adding in family members and how I cared for the family and the patient.
Mm-hmm.
Oh, well, I have one, but I don't know. This is like really patient centered, family centered. It was during my CNA shift as at the unit. I was a sitter for this patient, and basically, the mom wasn't really happy that they were here and that like there was a sitter watching her eat the entire time. And I had to explain to her like this was a hospital policy, and I know that like it might be very disturbing for her for the daughter, but it's just something that I have to adhere to. So I don't really think that's know if that's really family centered.
So family-centered care, a really slam dunk one is if you like I don't know if you did like a postpartum or like mother baby type unit and like the first time you teach them how to give the bath or change a diaper or
Oh, actually, yeah, yeah. Thinking about it now, I think during my I did my preceptorship inside the postpartum unit, and this dad didn't actually know how to change a diaper, and my preceptor just taught me like 2 shifts ago. So like I kind of was like I know what I'm like I think I have a great idea about this. So then once the baby came to our like once we bought the baby from L&D over to postpartum and we admitted the mother and the baby in, I noticed that the baby had passed her first meconium. And the dad was like, "Oh, like I was telling the dad like, hey, dad, do you see like the diaper like it's full now?" And the dad was like laughing. And then I noticed I was like, "Do you want to change the first diaper?" Because I've changed so many that I was like, I want to give dad a shot. And he's like, "I actually don't know how to change one." And I was like, "Oh." Lucky for you, I just learned as well, so we'll learn together again. So then I told him you need a diaper, and I taught him a way to change it effectively, doing it at the same time, and how to wipe. You only need like a couple wipes, and then you just put on the new diaper and take out the old one. And after he learned how to do that, he was like, I can tell he was happy. He felt like that proud dad moment. I felt that in him because he was smiling at the end of it, and I think that's the story I could use maybe.
yeah, yeah, definitely. My favorite part is seeing him like because I feel like a lot of the dads they're like, if I touch it, am I gonna break it? You know what I mean?
Yeah,
Like
yeah, yeah, yeah. I
they're
think
like
that's
they're scared, you
yeah,
know?
fear of dads or like holding them, trying to like coddle them when they're
Like yeah, like
crying.
the swaddle, they're like, I made a burrito, you know, like they're
Yeah, yeah, yeah. I
proud and
think
excited.
one of them try to learn how to do a swaddle. I think they're really scared of like harming their baby. I never thought that would be family centered. I never thought of it in that lens, but looking at it, that is kind of like family centered because it involves
Yeah.
dad and baby. Okay.
Yeah. And then with family centered care, I think the main thing is realizing you don't take care of just the patient in a vacuum, right? They have their support system as well. And if, family members come in, you want to make sure they feel valued. And they might ask, tell us about a time that you made a mistake and how you took accountability for it and made changes.
Yeah, okay. So this happened during my rotation as well. I was instructed to do a blood sample and a urine sample on a patient who we just admitted. And after completing the urine sample and the specimen collection, I put it into the collection tray. But what I had forgotten was that I did not put labels on any of them, so it just was blank. And when the lab took it back, they called saying we have a unlabeled specimen here and we're not sure whose this belongs to. And it took me a little while to figure out that was my patient because the nurse was like, the value the like the lab should have came back by now. Like he's been here for an hour, and that's when I told, like at that point I admitted to the nurse like I honestly think that was my fault. Like I take full accountability for it, and I think just a learning moment from that was to really before I do anything, just to really gather all my materials and make sure that I'm doing it on the right patient because I could have jeopardized that could have not been the right patient at all. So just moving forward, I really learned to really be attentive to detail and making sure that before I do anything, just have everything in my hand so I don't forget it in the future.
Yeah, attentive to detail. And then you could talk about how it caused a delay in care.
Some of the nurses, like, I think they crack jokes at the end. At the end of the day, they're like, "Oh, don't forget to put a label on this one too." So like,
Yeah.
'cause I think the nurse laughed. She's like, "Oh, don't worry, I made that mistake when I
Oh, yeah.
started." So
Yeah.
I think it's a very common mistake, especially like in an where it's such a fast-paced environment. Like I think the small things like that are easily forgettable,
Yeah.
she
I
said.
think everyone is at least once.
Yeah.
And it's better than putting like the wrong, like what if putting like a label for the wrong patient or something.
Yeah. Totally.
Okay, cool. So a time you got feedback or a time you got constructive criticism, and it's more about the points are for if you're receptive to feedback. So you basically talk about, I mean, it's easier if it's about a skill than about like a personality trait kind of thing. Just talk about something that you kind of sucked at, and then someone gave you the super helpful trick to use or tip or whatever, and then talk about how much more confident you were after practicing with that and how much you love when people are willing to, especially if they have years of experience, to just give you
Yeah.
that advice. What if there was a skill that everyone kind of struggles with that you were struggling with, like IV angle insert, like IV insertion, or like
Yeah.
the perfect drop of blood for a blood sugar? Or for me, it was I could not figure out the roller clamp. Like I would always do it wrong.
Oh,
Like
okay.
something where it was they were like, "Hey, if you do it this way, it's gonna go so much smoother for you." And then you practice with it.
Okay, I have two. I have one that's like I couldn't get my an IV in. I also have another one where it was so hard for me to remember the EKG leads, and when it was important time to actually do it in such a fast pace because we were expecting a potential MI, I just couldn't perform the leads at the right time, and I think my nurse like wasn't really too
Maybe
happy.
talk about the I think the IV is gonna be a better one for you.
Okay, okay.
Oh, so how's that one go?
Yeah, so I had a patient that came into the and we had to start an IV. And at this point in time, it was like my second or third time ever starting an IV. So I noticed that when I wanted to start the IV, I went into the patient's vein, and when I had applied the tourniquet, I saw a vein that I thought was going to be good enough to insert the IV. But when I inserted it, I met like kind of like a hard resistance. And when I thought I had gotten flashback, I didn't further the catheter in and I lost the blood flow return. And at that point, like I noticed that the patient wasn't really feeling comfortable after that. So then I had asked the nurse if that the nurse had pulled me aside and said she'll take over this one. And I think afterwards I went up to the nurse and I was like, can you like teach me how to like insert an IV correctly the next time? And she told me that I wasn't angling it down enough. I was more doing it perpendicularly. So she said I had to like lower it down to like a 10-15 degree angle for me to like slide in the catheter and further advance it. So from there, like I had asked her if I could be in the triage room for like the remainder of the shift and like practice more IVs. And to be honest, eventually like, I got good at it. Like, I was able to start like 40 IVs for the rest of the shift. And I think her just guiding me through it and just practicing it like visually, I was able to grasp that concept better.
You say 40 IVs?
Yeah, it was like community hospital. It was a community hospital. So like it was a lot of patients that come in and out. So like our
Huh,
waiting room was really big. We had like 4 trauma bays, so it was really big.
that's crazy.
Yeah.
Okay, I like that. You get to like come out the other side confident and like confident in the skill, you know what I mean?
Okay.
And
Yeah.
it shows that you were super receptive to feedback and you took what she said and practiced with it and took it to heart and got better. Yeah, the points for this are usually something about being receptive to feedback. So say something at the end that basically says, without saying, I am receptive to feedback.
So it was like overall at the end of it, I just really appreciated the tips that she given me because those tips have allowed me to further furnish my IV skills for
Yeah, or to, to become really much more confident with
IVs.
skills.
Okay.
Yeah. One that they sometimes ask that's kind of overlaps with the conflict question is they'll
Mhm.
say the reverse. They'll say, like, tell me about a time when you had to give constructive feedback.
Mhm.
And it also kind of overlaps with like tell me about a time you were on a team that wasn't working well together and how you turned it around.
Okay. And these are two separate questions, or it's more like,
They can be. They often have like the same answer though. Same.
okay, so it was give tell a time that I had to give constructive feedback
Yeah.
and when a team wasn't working, what did I do to improve that?
Yeah,
Like,
like it might be the same answer. You might be thinking about something different for each one.
mhm.
But yeah, something, yeah, we're kind of heading towards like the conflicty kind of stuff, and I'm trying to see what stories you have that we could match to different questions.
I guess for the conflict one, I have this specific one, but it could also be more like advocating for patient, but maybe I can explain and you can see.
I
So
think it's another really common one.
Okay. So for this patient specifically, when I was shadowing my nurse, we were administering medications for this patient on a unit, and the medication was metformin. And I noticed that each time my nurse was scanning like her metformin, it was like saying something about like exceed dose, exceed dose. And at that point, I was kind of wondering what that meant. And I was like, hey, I don't know if you saw, but it said like the dosage was exceeded, and like it was really hard to miss it because each time you scan it, it would show up and it would ask you to override and click yes. So then I asked the nurse like, oh, like does that happen a lot? She's like, oh, that's okay. Like that normally happens with her medication. And then to me, like as much as I want to let it go, I just didn't feel right to me because I was still really fresh in my nursing career. So I was really like curious. I was like, why is it doing that? So I was reading the tablet that she had, and it was I don't remember. I think it was 30 milligrams metformin, and her dosage I was saying it was 15. So I think what had happened was the nurse was giving more dosages than what the patient actually needed. And at that point, I tried to come off respectful to the nurse instead of scolding her. I was like, "Hey, I just want to be honest, straightforward with you. I think that the dosage that she needs is actually a little bit lesser than what we were scanning." And I was like, if you want to take a look, we can both double confirm. And she saw that and she's like, oh, like you actually caught my mistake there. Like I really appreciate you looking after that, because she said normally sometimes my coworkers would say that's fine, but you were really adamant and really triple checking what I was scanning. And I think she thanked me for that. And from that, I really felt I would save this patient, because what if we overdosed her on metformin? That definitely would have been bad in the long run. So I just learned that sometimes when you see something that you're not comfortable with, always just approach it in a professional manner and try to like hear each other's opinions and resolve the conflict there.
Yeah. Yeah, I like it. You know how firehouses or like the military, there's like almost a hierarchy.
Yeah.
If you don't like play your cards right,
Yeah.
they'll come down on you.
Mhm.
Nursing is like that. So I would almost say, is this here is where it says the dose, right? And
Mhm.
maybe she said, right. Oh, I see, I see. So it's supposed to be 15. That's why it's giving me so you know, pointed it out by asking a question for your education to kind of lead her to see, because you wanted to be respectful, and it's possible that there's something that you don't know or don't understand that she could teach you. You know what
Mhm.
I mean?
Yeah, yeah, totally.
Doctors, right? Like the people who always get in fights with the doctors are the ones that don't kind of do that dance, right? They'll say, if you get an order that like makes no sense for your patient, instead of being like, what the heck is up with this? Like some
Yeah.
nurses might do, you could say, I want to be able to understand so that if the patient and the family has any questions about it, I'm able to explain the indication for this patient. For my education, can you tell me how we're using the med for this patient? And they might be like, I didn't order that for that patient. Oh, shoot. Hang on. Don't give that. That was for another patient. You gotta kind of like
Okay.
lead them in a very like unassuming way.
Yeah,
You
yeah, yeah. Okay.
Is there a way that you could do that for this?
Um,
Or yeah, maybe just is
so
this part here where it says the dose that
yes,
we give?
so like for example, like on like a wrapper for like a medication, it would say
Uh-huh.
like 30 milligrams like per one tablet or something on the thing.
Uh-huh.
So I think on there like it said that, and I was like, and I remember saying, hey, what is the usual dose? I asked her, what's the usual dosage for a metformin at like for this type of patient? And she said it ranges from like I think 10 to like 40 depending on like the doctor's orders. And I was like, oh, I was just asking just because like in future references, I just want to know what the proper dosaging is. And I kind of pointed at the patient's chart, and I was like, on here it says 15 and this one says 30. So are we splitting the pill? Like how does that work? And
Yeah,
then
that's it.
I think that's when she realized that it was not the right dosage.
Yeah.
Okay.
And maybe to say, because she's so knowledgeable and I'm new, I wanted to really make sure that I'm asking the question in a way that is respectful and supportive and not judgmental, but I also knew it's my job to advocate
Oh,
especially
okay.
if I
That's
think they're
tying in everything
there.
together. I see.
Yeah.
Yeah, I
Yeah.
like that. Okay.
Yeah, it's like a special skill because it's like if you just play the hierarchy game, the patient takes the fall. You know what I mean?
Yeah, because
Yeah.
patient safety is like important at the end of the day, above
Yeah.
all.
Yeah. You could use that for, yeah, a time you had to give feedback, a time you had a conflict with a coworker, a time you had
Mhm.
a conflict with a supervisor. What if they say specifically a doctor? What if they say like working with doctors can be stressful? How would you handle a conflict?
For that one, I'd be like, I always like to humanize people in every situation that I'm in. And I know that, if a conflict arises with a doctor, there's always an underlying premise as to why that is. And I'd go something along the lines that, like, I would first try to talk with the doctor with respect in a professional manner and ask him if there's anything that I can do to help improve that conflict that we have. Is there something we can do to talk it out to resolve this conflict? And if I notice that the actions that we're doing is not being resolved, if I still notice that conflict hasn't been resolved, then I would try to involve the charge person to see if we can work together to resolve this conflict. And I think from there, it's just important to really hear each other's opinions out because it could have been something really small. And if we were able to fix it together, it can improve our relationship moving forward.
Okay, yeah, I like it. And then making sure that you really keep the focus on the mutual goal of doing what's going to be best for the patient, making
Okay.
sure that you really understand.
So should I say like I always try to humanize people for any conflict I'm in, but I know in a hospital setting, I have to ensure that my patient safety is the number one concern, and then talk about like
I
uh
mean,
uh,
maybe just like as a, I liked what you said, maybe just as an added thing,
oh, okay.
to make sure that I'm approaching the conflict in a way that is supportive, seeing what I can learn, seeing how I can help, making sure that I'm keeping my focus on doing what's best for the patient. Um, yeah, I feel like you can say all of those things, but I would tell this story because you could say, I haven't had a conflict with a doctor, but
Mhm.
I've had to advocate to prevent a med error with a nurse that I was
Mhm.
following that was supervising me for the day and talk about that.
Okay,
Um,
yeah, definitely.
yeah. Hey, just so you know,
Mhm.
the videos that you see, I cut out all the stories that like I didn't love for that person and
Yeah.
like most of the redirection because I
Mhm.
feel like one out of respect to them, I wanted to just be like a highlight reel just in case their like future employer sees it at
Yeah,
some point. And
yeah,
then I feel like people's attention span like isn't gonna wait through the parts that they don't want to copy, you know what I mean? So
yeah.
you're you're doing really, really well. I don't want you to think like I don't know. I feel like you know how social media is all just like a hot.
Oh yeah, totally. And I know like I have room to improve, so like I
No,
totally
knocking it out of the park.
thank you.
You know what stories are super helpful that can kind of be like wild card stories are the ones about like they can ask directly, tell me about your most critical patient or like a time you had to act quickly to keep a patient safe or whatever. But if they don't ask that, people put it for like a time they advocated or a time you had good communication, good teamwork, good collaboration, which I feel like would be likely for an OR interview.
Yeah.
Do you have any stories about a rapid response that you might be able to use for all that kind of stuff?
What a
Yeah.
sepsis one count?
Yeah.
Okay. Yeah, so for me, it's always at this I feel like I've learned so much at this rotation. So at this rotation of mine, we had a patient that came in with a code sepsis. I immediately noticed that because me and my nurse, when we came in, we took his blood pressure and it was really declining. And I could see the sweat from the patient's face and her temperature was like around 103. So that's when we noticed that like something septic is going on. And we immediately like I asked the nurse if there's anything I can do right now to go help quickly solve this issue. So the nurse delegated me to go help, grab like an IV bag of just normal saline solution. And I went to go grab that, and I immediately started the IV on her to help restore the fluids right away. And while I was doing this, she went to go grab antibiotics, the broad spectrum antibiotics, and she gave me the Tylenol that we had to administer rectally, I believe, just because he had,
Oh,
so we had to administer rectally for it to absorb the fastest. So I think that scenario, maintain the constant communication of what I'm doing. Because I remember I was telling her I'm inserting an IV now, and I was telling the rest of the team that I need help flipping over this patient so I can administer the Tylenol rectally. And just by like really voicing out what I'm doing step by step to like my team, we were all really cooperating in such a liquid motion. And from that, I really learned that just maintaining a constant communication in any critical case is necessary in order to benefit the patient at the end.
okay. Yeah, I feel like you could use this for all the things that we listed. So, with septic patients, before you give antibiotics and usually before you give the fluids, they want you to what they call pan culture the patient, which is basically
Mm.
just grabbing like because basically they need that so that they can test different antibiotics against it to see what
Right.
it's
Hmm.
susceptible to. So if this person had it, they probably would want to do like a chest x-ray to see if it's some sort of pneumonia, I would think. Did you guys draw like when you started that IV, did you draw labs?
Yeah. Oh, I think I forgot to let. I think I totally left that part. I'm sorry. Yeah, yeah, I was in charge of like starting IVs and starting the IV bag. So I noticed that like his skin was like really, I think yeah, his skin was really dirty and like had a lot of like debris. I think he came from a and he wasn't really properly taken care of. So then I had delegated to my friend if he can help me clean, like my classmates help me clean his like arm so I can like insert the IV because I was scared that like, we might get a bad reading if like I inserted in like an arm that wasn't clean. So then I did the routinely lab blood draws. I think it was like all the color tubes and like the culture swabs. I just forgot what they were
I would
called.
say the routine labs that we do for the sepsis protocol there was we draw a rainbow and a lactate.
Okay, lactate, rainbow and lactate. Yeah,
Or sometimes it's especially if this is a like a patient, they probably did a blood gas with lactate.
blood
Or
gas lactate.
with
Okay,
lactate probably.
okay.
But yeah, instead of saying like all the colors, I feel like what they say is a rainbow. We drew a rainbow.
You do rainbow and then just with lactate.
Yeah,
Okay,
rainbow and then a VBG with lactate.
okay, for
Yeah.
sure.
Because that'll give you like all her respiratory stuff.
Mhm.
And it'll give you the lactate, like if let's say her lactate is like 3 or 4 or something, like clearly she's septic and you can trend it. You know what I
Mhm.
mean? Um,
Okay.
yeah, so but not just the labs, the cultures. So you need like blood cultures or like a sputum culture if she could produce it, or urine cultures. The chest x-ray kind of gets thrown in with that because it's like you get to see visually like pneumonia basically.
Yeah. I remember my nurse doing a cath, a Foley cath, like I think it was
Oh,
a
and
straight
taking a
cath,
sample from there.
yeah. Because I think
Ah, straight
I
cap.
remember this, we had to like cut his pants, I remember, if I remember not. And I think my nurse, she went in and did the fast cath. I forgot what it was called, intermittent catheter.
Yeah. Straight cap,
Just
yeah.
yeah, a straight cath, yeah. So she grabbed the urine culture from there.
Okay. And then did they do blood cultures?
Like the IV blood tubing.
Usually it's like two peripheral sticks and it has that bottle that looks like a like you know what I mean? The one
Oh yeah, like that long bottle and like it's like has some, yeah, yeah, I remember they were doing as well. I
yeah.
think they handed that to me to like fill it up for them. Yeah, they're
Yeah,
like,
so you could say I drew blood cultures while my preceptor got the straight cath.
okay.
Yeah, we pan cultured the patient, also got a chest x-ray.
So pan culture, BBG with lactate, rainbow, and chest X-ray while my nurse was doing a straight cath for this patient.
So usually it's you get your cultures, you give the fluids, and then you do your broad spectrum antibiotics. So usually like Vanxos whatever. You could just say broad spectrum antibiotics and the Tylenol. And then after a couple days, because you got those cultures before the antibiotics like
Mhm.
affected them, the results will come back and then they'll switch it to some kind of like specific one for whatever they're growing.
Okay.
But yeah, sepsis is always the same flow.
So
Um,
they would like it if like I address it in like the proper manner like that.
Yeah,
Like,
so like for example, let's say because I used to think like, oh, this is infection. The most important thing I can do for this patient is I need to start the Zosyn right now.
yeah.
And then it's like, oh shoot, now I've ruined my cultures, so they can never get the specific antibiotic for this
Oh,
patient because they'll
right.
never know because I
Yeah.
ruined the cultures by starting the broad spectrum antibiotics.
Okay,
You know what I
so
mean?
like really important to draw those labs first, like every type of labs and blood
Cultures
culture.
first.
Okay, for sure.
And then the idea is the antibiotics will circulate better if the patient has like circulation from the fluids, get their blood pressure back up.
So in this question, are they asking like how like what my contribution was in this scenario? Is that basically what they're looking for?
I think the way you told it is fine. Some people are like, oh, well, my preceptor did all that stuff. And it's like in an emergency, your preceptor isn't going to just stand there with their hands behind their back and like let you
Yeah.
tumble, right? Like you're going to work in tandem. So you can divide it up kind of how you said, because you did take on a lot of that. Or you can say, we did the straight cath, we did,
Okay.
you know,
Yeah,
that's
because
what people do if
my
it's not.
hospital is a very it was a very teaching hospital, so like they really wanted students to like be hands-on,
That's so
which
good.
I was grateful for that because I feel like I'm a lot of my stories come from this is because I feel like that was where I was most engaged in.
Yeah.
So yeah.
Yeah. Would you ever work in the?
I would consider it. That was actually my first option. Like as I was in nursing school, I thought
Mhm.
that was really cool. But once I saw like what the aura does, I feel like that like sensation, like what I mentioned in my story earlier, I feel like that I was drawn more into the OR. But eventually, if I want to pursue different branches of nursing, it will definitely be my next stop for sure.
Okay, okay. So yeah, you could use this for, let's say they said like, tell us about a time you had great communication. You
Mhm.
would talk about the closed loop communication that you used in this situation. I'll start an IV and get labs. So just using that closed loop communication, like tell the story kind of in the framework of how great it was to see everyone communicate what part that they were going to take on and
Okay.
communicate when that had been done. Labs have been sent. If it's about collaboration, talk about, I mean, you know how to switch it up for basically, I'm saying you could
Yeah.
put a
Okay.
pretty little bow on the front end of this for all the positive parts of the teamworky stuff that I feel like would be pretty likely for OR.
Yeah, because OR is really teamwork. So I feel like they'll definitely ask like a specific example where I demonstrate teamwork. Oh no, no, I was like trying to think of a time I practiced EVP because
Did
I
you do
remember.
a research class?
Yeah, my research was on fall risk adults in the neurosurgery unit.
Yeah.
Uh,
Managers really care about preventing falls for sure. And like falls happen in the OR, right? It was like transferring between one table and the other.
yeah, the
Like,
other.
shoot, we didn't communicate right.
Mhm. I think for this one, it was that I found that there were more studies showing that the increased risk of falls in the neurosurgery unit was that sometimes the field of vision after neurosurgery can become impaired. Like not impaired, but like I think the first couple of days after neurosurgery, I think their eye vision isn't really like at its peak. And they found that when they put the table, like the bedside table or the call light on like the same side where they have bad vision, they forget that it's there and they don't push the light when they need help. So they try to get up on their own and they fall. So I remember one time when I was a CNA although like I don't know if his vision was bad, I just remember doing this research article paper for my research class, and I remember that I had asked him, like, "Hey, are you able to see okay?" And I just remember him saying that like, his vision isn't the best. So I said, "Which side can you see the remote better?" And he said his left side was definitely better. So I said, "I'm gonna put the remote on your left side. So if you need to get up, you can call that, and I can come and help you assist you to the restroom." So just taking that preventative measure, and although like his vision could have been good, I just wanted to help the unit like reduce their risk of falls because I know falls is such a big priority for hospitals, and I would love to just take preventive measures to ensure that the patient is safe at the end of the day.
I like that. You could also talk about how, as a new grad, you really want to work somewhere that is constantly updating the policies and procedures to reflect the latest research, and you want to be the kind of nurse that actually not just does research and reads, but
Mhm.
actually bridges the things that have been shown to be effective into the everyday care with patients.
Yeah,
Right?
especially for I think one of their like main mission and values is like
Yeah,
so.
and it's one thing to like read about it, but then to actually like use that with a patient. It's like
So
that's
then, yeah, I think I
that's
can tie
different.
that to like given that. this reputation is. I took this upon myself to utilize the research that I've done to help ensure that we are meeting the hospital standards and ensuring patient safety.
Yeah. And like implementing the things that have been shown to be effective. Yeah.
Okay.
Yeah. Then what if they say, can you tell us about any leadership positions that you've held in the past?
Yes. During my time at school, I became a PALS tutor, which is basically like, just a peer assisted learning for underclassmen for students who are in other core classes of nursing. And I particularly really enjoy teaching pediatrics and mental health because those were the subjects where I really found myself most confident in throughout nursing school. And eventually I love teaching and really like trying to teach the new generations of nursing students, to help them just feel more confident about their knowledge and their grades and help them hit the grades that they want. I eventually took on a coordinator role, junior coordinator role. So I basically trains new tutors to help come up with a lesson plan with professors to help achieve student outcomes, like help them achieve the grade that they want. And I think just creating a better lesson plan that allows students to actually stick through it. Because I know sometimes professors can really be confusing. Like I'm sure everyone who's gone through nursing school understands there was that one specific professor that wasn't really clear on guidelines or like syllabuses and stuff. So I met with the professor itself, with herself, and luckily I had a couple of professors who were really kind to me, and we worked together and made such a straightforward lesson plan that allowed students to really see dramatic improvements throughout the rest of the term. So that's one leadership moment I'm really proud of.
I really like this one too. I feel like it sounds super professional, but I can also picture you being a really cool preceptor. They might ask, sometimes they ask, like, what are your short and long-term goals? Or like, where do you see yourself in 1 and 5 years? And I'm trying to think, like, what does the progression look like in the OR? Is it,
Uh, yeah, I think I kind of did research on it. I was gonna ask him
yeah,
tomorrow too at the end of the
the
question.
preceptor for
Yeah.
sure.
It's preceptor and then it's charge nurse. And
Mhm.
then if you want to go back and get licenses, it's called a CNOR, which is like,
They're gonna
uh,
love that you know that.
yeah, yeah, I just
He's an
wasn't sure.
OR nerd.
I
Okay.
kept I kept researching, but I kept being dead ends. And then I think CNR you can go back. I don't want to mention nurse practitioner, but I know like you can become specialized like nurse practitioner in certain parts of the OR. And then you can, I think this one I'm gonna say is just like certified registered nurse first assistant, which is like you assist directly with the surgeon. I
Yeah.
think that will take more schooling, but I was gonna climb up the ladders. Like, I've had a history of teaching students in my school class before, and I've loved to become a preceptor and really just after preceptoring, I want take challenge on how to become a charge nurse and eventually obtaining my CNOR license. And really, my ultimate goal is to become a certified registered nurse, first assist, and helping surgeons in every way possible to improve our patients' outcome.
Okay. You could also maybe talk about getting involved in any hospital committees or if there's any quality improvement projects on the unit you
Oh,
to be able to help drive those forward.
yeah, I think it has unit peer council. I think that's what they call it. So
Yeah.
I can probably mention like they're like I want to like help. I want to join the unit peer council as well to help see if there's any gaps that we have in our unit that we can improve for our staff.
They have to prioritize internal candidates.
Hmm.
So the fact that you like already work there and know this stuff gives you a leg up. And I think the fact that you did your preceptorship there, which you didn't I don't think you mentioned that in your about me.
Yeah, I did not mention that.
It's
No.
hard because it's like
Yeah, because it's like
it's a
such a
mother
total.
baby.
Yeah, I know. Like, because I remember when they ask, like, I went to it like my other hospital because I for my job it's two hospitals that I go to,
Yeah.
and the other one I went to, she asked me like, Do you have any experience in ER?" I was like, "Well, I've only had it in mother and baby during my labor and delivery. Like when I was able to like go inside the labor and delivery and like just see like a C-section. But I was like, other than that, not really much. So then that's when I realized like I gotta like try to find something like
Yeah.
outside. So like when I talk about our interview, I can like at least have some experience on me. So um, that's why I didn't really want to mention it because it's like I don't want to throw him off. That's like, so he
Yeah.
did mother and baby. Does he want OR or not? Like I just didn't want to bring that up.
Right, right, right. You know what I just thought of? We can use this for your, because there was a girl who, did she say for? So for strengths and weaknesses, strengths are pretty easy. We'll talk about those. But for weakness, you could maybe say, my weakness coming into an OR position would be that while I was really lucky to get my preceptorship I was not able to obtain a preceptorship in the OR. The closest I was able to get was mother baby being able to see C-sections occasionally. And so I realized that if I really want to work in the OR, this is a weakness that I need to work on. So I sought out opportunities to get more experience and then talk about the ones that you did. And
Oh, yeah, that that that's actually a really good weakness, actually. Yeah, I
because then
like
you're
that.
talking about like how you've worked on it.
Yeah, it's like a
And
positive weakness. It's like a weakness that like I'm not good at. Like I didn't have a lot of like a lot of understanding in, but I took like further precaution, like further action to gain knowledge about it and what I learned from it.
And it shows that you're like dedicated to the OR,
Yeah.
right? It's not
Yeah,
just
yeah.
like, oh, sure, I'll try for the OR, whatever. And if you think about the other people that you're up against, if this is specifically a new grad position, like
Mhm.
what OR experience are they really going to have?
Yeah.
You know what I mean? And it's better that I feel like literally everyone is like, I'm really hard on myself. I'm a perfectionist.
Yeah.
You know what I
I
mean?
feel like I was gonna use that one, but this one's so much better. I feel like I like this one so much more.
Because then it shows, I keep using this word professional, but I feel like it's showing that you're like driven about the OR. Okay, so for strengths, what would you say for strengths?
For strengths, this one I wanted to tie it more on like what the notable skills are within the OR because
Okay,
I noticed some throughout my entire OR. For me, it's really being attentive to detail, really maintaining a professional communication, whether it's closed or open loop during the OR, and just being able to be adaptable to any fast-paced environment. Because I feel like those three notable traits will allow me to really excel in the OR. And then should I like talk about each specific skill that I've learned
I'm
or
just
should I
gonna look up, I've never heard of open loop communication. Is that a thing?
I think I made that one up actually. But I think just close it like just like I said earlier, it's just like, hey, I'm gonna do this or hey, I need this. Just like
Yeah,
maintaining
like
like
I always hear closed loop communication, especially when it's something where like you have to be really specific, right? You're like in a code and they're like, I heard 1 milligram of epi. Is that correct? You know what I mean?
okay.
Instead of just like, sure, I'll give
Yeah.
epi. Like,
Okay, for sure. So, like, yeah, my top three strengths I would say would be being able to be adaptable or like blend in every scenario, every environment that I'm in. Being able to work in a fast-paced environment, maintaining a professional close-loop communication, and just being very attentive to detail. I feel like those three really come hand in hand in the OR and really being able to fully grasp the understanding of how important these skills are really will allow me to succeed in within the OR field.
yeah. And even like I feel like you'd be really good at respectfully handling conflict too when it arises.
Okay.
Like it's with the communication, right? Because I'm just thinking about that, like the stereotypical scary anesthesiologist, right? Like there's probably a skill that you have to have where you know how to like handle conflict respectfully and
Okay.
build relationships.
Yeah, so I could be like being able to respond to a conflict and just maintaining a professional communication.
Mm-hmm. Yeah. What have we not gone? Oh, we haven't gone over the cultural one, the one where they're like, tell us about a time you provided culturally conversant care.
So I'm part Chinese and part Thai. So the patient that I had at this specific hospital during my clinical rotations, she was Chinese and the family, although she didn't really speak proper English, it was more like broken English. I came and introduced myself to the family and I was like, hi, my name is and I'm gonna be your student nurse today. And when it came to medication time, at least, I noticed that I just remember from the top of my head, like Chinese people, they really enjoy like their hot, warm water with everything that they drink. So at this moment, I asked the nurse, is this medication okay if we give it with warm water? And I asked the patient's family, like, hey, would you like some warm water instead of room temperature water? Because I know like in the pictures we give, it's like ice water. So what I did was I gave her warm water because I know that like they're more susceptible to be drinking water if it's warm. And I asked them if that was okay, if he took it with this medication, and she said that's totally fine. And I think at that moment it showed that I was kind of more aware of the culture she was coming from. And it just made me feel like I was able to help her out in every way possible, even the smallest details.
So I used to kind of suggest this stuff, and then one of the new grads I was working with, he was like, I really don't like that. I was like, why? And he was like, okay, so for example, my girlfriend is from Argentina and I wanted to impress her. So
Yeah.
the first date, I took her to a steak restaurant because she's Argentinian, right? She loves steak. I realized once we had ordered, she hates steak. And I felt so dumb. Thinking
Oh,
like everyone in the same country obviously doesn't like the same things. So uh ever since then I'm like, oh right, like yeah, I guess you kind of have to talk about being mindful of cultural preferences, but
mhm.
then getting to know your patients as an individual, um, so I guess maybe just like asking, right? Um, do you prefer room temperature water, ice water, hot water?
Okay.
And then maybe talk about how they got excited realizing like, oh, I can have hot water. You guys have that here?
Okay.
Mm, no one's offered that to me. I'd love some hot water. And then that you kind of noted like, oh, that is their preference. I'm gonna, you know, make sure to provide at least offer hot water every time I'm in the room and pass that along and report. Um, say something where it's like you weren't just like, oh, you're Chinese, you probably want hot water. It's
Okay.
like let me
It's
ask
like
your preferences because it likely, but like I'm not gonna assume.
okay, so like just reword it, just like
Yeah, just
you
like
noticed he
rewording.
was from a Chinese background, and when it came time, it came time to administer medications, I asked her if what type of water she would prefer, like whether if it's cold, warm, or hot. And when she heard hot, like I saw that she really got excited, and she asked me like, "Oh, is that allowed?" And I was like, "Yeah, of course." So then from there, just it taught me to really be aware of like our patients' cultures, and these small little details can really help our patients feel more welcome and like more comfortable at this hospital.
Yeah, and maybe like get to know them, be mindful of their culture, but get to know their individual preferences. To and then maybe talk about how you love any opportunity to bring what brings them comfort from their home, from their culture, more into their bedside care to make it more
Okay.
patient-centered.
Okay,
Um,
that makes sense.
yeah.
'Cause I know they're gonna probably ask like why, maybe.
Yeah. Yeah, for sure.
I was gonna run this one with you to see if it makes sense
Okay.
because I want to talk about it more as like my growth here. I feel like other candidates will talk about like because I was gonna be like, oh, number one, and I feel like that's very common. But I feel like since I'm an insider, I wanted to provide more like anecdotal story. I was gonna say like one of the reasons why I chose amongst other hospitals is because personally, I feel like I've grown so much here at this hospital. Ever since my journey as a care partner, I've really been able to really feel like what it feels like to work at a hospital that really prides itself in healthcare excellence through innovative innovation and continuous education. And I really love the part where it really tries to create a supportive environment for the growth of a professional nurse that really kind of aligns with who I am as a person, where they really want to nurture the nurse's intellect, the nurse's feelings and imaginations. And I feel like for me, that sets apart from many other hospitals throughout my time at many other hospitals during my clinical rotations. And I know that this environment is going to be where I want to develop professionally as a nurse. And from my time being here, I've gotten to know a lot of unit managers and a lot of nurses here. Primarily my managers, I've looked them up to more as like my mentors now. For example, I've had the ability to make suggestions to our resource teams, and I found that we had a problem with care partners not knowing certain tasks to do at different units. So I suggested coming up with a flowsheet template that we're in the process of getting approved right now. And instead of shooting me down directly. Like they were very responsive. They really helped me, gave me positive feedback on how to really make sure this template gets approved, and we worked it together. And I feel like this moment, like I knew that really wants their nurses, their care partners to really grow positively and make such a positive impact on patient care. And I feel like has given me such a good opportunity for me as a care partner, and I would love to give back this opportunity as to grow professionally here as a nurse and just overall develop to become the true nurse that I really want to be. Some of the hobbies that I really enjoy doing outside of work to just really like de-stress myself from everything is I enjoy working out. Being able to work out and create such a healthier lifestyle will not only make you feel better internally, but outside, like you're more energetic, you're less stress-free. And I also I enjoy cooking, although I'm not the best, I'm still trying to get better at it. And recently I've been reading more into like how to invest properly for like my future, like in terms of stocks and just retirement and those things. I really enjoy just like reading up on things that, interest me. And same thing could be said for any other thing that I really seek my out on. And these are some of the notable tasks that I really like to do on my free time.
I wonder, is there something that you like to cook? Like the guy that I was telling you that got the OR job, he was talking about like how he's into like working out and being healthy, and he was like, but I also really like trying to find like healthy recipes for things that I used to eat,
Oh,
like
yeah,
the
yeah.
donut.
Yeah, for me, it's I try
You
making
watch that
it.
one? You know what I'm talking about?
I don't think I have, but I know what you're talking about because
Yeah.
for me I liked I'm a I have the biggest sweet tooth for someone who's really into fitness. So I bought like a ice cream maker from Ninja Creamy and I've tried like making so many recipes of like, like chocolate chip or like double fudge brownie. And like I've tried making them all. It just doesn't taste the same, but it does the job.
I feel like I mean, especially they're probably women. They're probably like we all got a sweet tooth. They probably relate to that. Yeah, you should say that. Okay. So you kind of have to listen to how they ask it. If they talk about like self-care instead of just hobbies, or like, because sometimes they'll say like, tell us about something that isn't on your resume, and that's when they're kind of like wanting to know that you like got an ice cream maker and you're like, whatever. But if
Oh,
they say like the self-care part of it, in addition, I would also kind of give a nod to like, basically they want to know like the first time that you have a hard day, you're not going to be like, nursing's hard, I quit, right? You like have
oh,
a process of like what you do on the hard days to grow from it and come back refreshed and stronger the next
yeah.
day.
So yeah, I really see like working out or running, for example. I've really picked up on running. I found that to really be a good de-stressor for me. I remember like I had another interview for a job before, and I like just ran a mile and I came back and like my stress was gone prior to the interview, and I forgot I even had that stress. So that's something I could maybe talk about in my.
Yeah. Maybe don't talk about another interview because I'll be like, why didn't they choose him? What don't
Yeah,
we
yeah. Oh, yeah, yeah. Yeah, for sure. I totally forgot about that,
You could
but
maybe just say like when I've had a hard day,
hmm,
it's something that's always really worked for me.
okay.
Yeah. I mean, sometimes they say describe a challenge and how you overcame it. It's the same thing. They're just like assessing for grit and assessing like you don't give up when things get hard.
Hmm.
Do you know what you'd say for that?
I'm someone who's really eager. So I have a challenge, I don't really know too much about it. I just remember, for example, I think I didn't really know how the albumin worked at the time. I think it was for cirrhosis. I remember it was a cirrhosis patient, and the nurse was giving albumin, and I wasn't really understanding the process of why they were doing that to like draw the fluid, like to take the fluid out of the body and like bring it out to the outer membrane. So I went home. Well, I forgot like the
The
process,
other way
like
around. The other way around. So
the
they're
around.
third spacing. So basically, albumin it's a protein that we all have in our blood.
Yeah,
The liver patients, they're always low in albumin. Not always, but most of the time they're low in albumin. So that's why they have like the ascites.
yeah, that's IDs.
So the albumin, if you give that to them in their blood, it lets the it's like an osmotic protein, so basically it pulls the water like into the vascular circulation where you want it to be rather than like third spacing out into tissues and like causing edema. So yeah.
Okay.
Yeah.
So from the third pace into back into the tissues.
Yeah, it helps yeah, it helps bring the fluid that is either being third spaced or it helps reduce edema and bring um the fluid back into circulation to help support the blood
Okay.
pressure.
Yeah, I remember like I didn't really understand that even the nurse kept trying to explain it to me. So I think I went home the same night and I watched like a simple nursing video about it, and I think that graphic really clicked to me. So, whenever I face a challenge, like I always try to learn it and like try to understand it. So that way, if I'm faced with it again, like I know exactly how to initiate the protocols or what to do, to really just and overall just feel confident about my nursing practice. I feel like
Okay.
an important thing to have.
Yeah, I like it. Do you prefer day shift or night shift?
I'm flexible, very flexible.
So the why should we hire you or like we have a lot of great candidates, why should we choose you kind of question is really you just basically kind of talk about your strengths most of the time
Oh,
unless there's something else that you think would
yeah, I feel like I'll probably put in my strengths and then I'd be like I'm someone who's really dedicated and I'd probably talk about my example of although like I did not have the opportunity to, learn more about the OR during my nursing school and during my preceptorship. I tried to take time to really understand what the OR role entails, and that which led me to get a job, like land a job at my outpatient surgical site and my internship at a surgical hospital, so I could really learn the roles behind an OR nurse and what to expect on a day-to-day basis and really just solidify my genuine passion for the OR.
those things up on your bookshelf, did you paint those?
Oh no, those are I'm Buddhist, so those are like posters that my parents got from temples.
Oh, I was gonna say we if so we got to talk about painting in your hobbies because
Yeah, I wish I was a painter.
what if they said if we call your last manager, what would they tell us about you?
I would like to take initiative. For example, for the ones that I talked about right now, my managers that I work with right now, I remember they had a meeting about how to improve our resource team. And I immediately, because it was a frustration that I had personally, which was like every time, because as a float, you don't really understand what you're doing at each unit. You're learning as you go. So what I did was I suggested to them if maybe we can make a flow sheet, for example, that will help people who flow to different units know like the general concepts of what tasks that needed to be done. And I feel like I'm a type A person, so like I really like to like have things done in a list in order for me to like really feel like satisfied with my job. And I feel like in this scenario, they would explain that I'm really someone who likes to take initiative and ensure that proper policies are in place to, make the job more enjoyable and not stressful.
I love that. What if they say, what kind of support are you looking for? What kind of preceptor or like how can we support you?
The support that I really want is someone who's really open and really patient to give them the proper education, especially for coming as a new grad. I'm gonna have a lot of questions, and I know I'm very curious on a lot of procedures and a lot of how to handle care. So I probably would love to have a preceptor who is willing to, take the steps to break things down for me and just guide me through the right processes that will really help me succeed throughout my new grad program here.
Okay. Have we talked about a time you had a miscommunication?
No, no, we haven't. For that one, I feel like I have one actually. Yeah, yeah. So I was working as a CNA and me and this other CNA, we were responsible for restocking each room with certain materials. And I had asked him if he can grab a new fresh pair of leads to put inside the little storage unit in there in case we need to like test the patient when they come in. And given that within the it's very fast paced. Once we bring a patient in, the proper procedure like, EKG testing, vital signs and everything. And this particular time, I have told him to grab the new sheets, the new pair of EKG electrodes and stuff. And when it came time for me to actually bring this patient into the room and do all these routine tasks, I realized that it wasn't there. And I realized that there could have been miscommunication. I wasn't sure if he heard me or anything. So I noticed that that drew my team back a little bit. So I took afterwards, I talked to my care partner and I was like, "Hey, I don't know if you heard. I wasn't sure if I was probably spoken to you, but I think I wanted to ask if you can grab me a new fresh pair of electrolytes." And what he had heard was if I had asked him if he saw Electra lead the 5 leads in there, and we had that miscommunication there. So I guess what I learned from that was that even though you may have asked your coworker for something, it's always better ahead to just go ahead and double check it yourself because sometimes the communication can be disrupted, and it's important that we always double checking to ensure we're giving the right care for our patients.
Okay. I like that. I feel like if the takeaway is about like preventing miscommunications in the future, I feel like because that would probably be the points for this miscommunication question. What would be the takeaway that would kind of speak to that?
The closed loop communication maybe
Yeah.
like really confirming if they heard it, like, so did you, like, are you gonna, like, did you hear me, or I don't want to like sound like a demand, did you hear me, but oh, I just want to like want to make sure you heard if I said it, I heard that, I want to make sure if,
Yeah, or just like verifying.
yeah, like,
Yeah.
oh, did you just want to make sure if you heard me ask for another pair of leads, like something like that.
Yeah, like when when you're the one communicating, making sure that you're communicating clearly and having closed loop communication, and then if whatever it was wasn't done, not coming from a place of anger or blame, coming from a place of curiosity and seeing, is there something on your end that was miscommunicated? You know for sure what you'd say for a time you advocated?
For a patient, can I use the medication?
Metformin?
Yeah, the metformin
Yeah.
one. I think that will work for advocate. Yeah, I
Yeah.
think I'll
But
be
then what
using.
would you use for conflict?
That's
I feel
true.
like conflict might be even more likely. And that's a slam dunk for conflict.
I had a patient who didn't really speak English well, and I noticed as I was coming in, the doctor was helping her move her bags as if she was getting ready to discharge. And I saw that she was still worried about something, and she was a speaker, so I really didn't speak at all. Luckily, there was a translator app on the iPad at our hospital, so I connected the translator and I told the translator to tell the patient, does she feel concerned? Like, there's something we can do? Did the doctor clarify something that we need to help you clarify with? And the patient felt like she still didn't feel as if she was treated the right way. Like she wasn't treated, like maybe the doctor missed something because she still felt really anxious and she felt like like jitters or some jitters. And when I just ran the blood pressure, I saw that her blood pressure was really elevated. So I called my nurse and I explained to her my situation, what had happened, and the interpreter also talked to the nurse as well. And from there, I asked the nurse if there's something that we can do to help this patient because I don't think she's in a state for it to be discharged. And it turns out that she was actually really dehydrated. So we ran the labs and she was really low. Like her lab values were really off the charts. I remember her was really high. So she was dehydrated, and so we just gave her IV therapy, like hydration therapy. So from what I learned from that was that if I had not caught that scenario, what had happened outside of the room, I wouldn't know what the patient would be like right now. Could that talk about an advocate?
Yeah, you can use it. Maybe just talk about how you learned that even though you were a nursing student, you're glad that you were confident enough to bring this up to your nurse and the doctor so that they could work it up and catch that they wanted to give fluids before discharging the patient to make sure that she had a safe discharge.
Okay.
They might ask, tell me about a time when you had to prioritize.
When I was a CNA, I floated to a med-surg unit and I was about to do my morning routine vitals for all the patients I got report on, but I got a phone call from my nurse saying that we just received a transfer patient, a new admission. So I immediately tried to clear the task I was about to do, and I prioritized my patient's new admission coming in because I know that like she wasn't stable, like she just got back from I think a medical procedure. So I wanted to help the nurse out with doing their vitals because I know that like the nurse has to do a lot of other stuff for admissions. And within my role of practice, I wanted to do everything possible to help the nurse out for her specific duties. So I took the patient's vitals. I did all the mandatory checkings, like to see if she needs like a replacement on any other parts of her body, like if she had like because I remember she had a peer wick. So
Mm.
I wanted to see if she needed to change a peer wick or just get her the sheets, get her like all the necessary linens. That way, a patient who's unstable, she receives the most immediate care compared to patients who are routinely, like, who have been there for a period amount of time.
Okay. It would be best if it was like a student nurse version of this. You
Uh,
know, you chose to do this intervention before this other intervention.
okay.
Like when you
Uh,
got report, like who you went to go see first because you wanted to make sure they were stable or whatever.
I have another one. I think it was like she just came, it was a knee replacement. Versus I had two patients at the time. It was a knee replacement patient and it was just a normal like med-surg patient. So I remember from fundamentals that like anything post-op less than 12 hours is some like they're not stable. So I went to this patient's room and I just checked up on her. Wanted to see if there was any bruising at the site. Did my head to toe focus head to toe assessment on like around her knees to see if there's any discharges that were noted, if there's any edema, and I just checked to see if, any changes in her vitals have gone over time. And then I went back to go report this to my nurse and then went back to go check on my other patient's vitals.
Okay. And then for anything like a knee or what, like you always want to check distally. You know how they're talking about like making sure she has pulses, that she has sensation, the color, the cap refill, all of that, like I guess on that foot.
Okay. Oh, like just doing like the compartment check, like the six P's.
Yeah, and like yeah, blood flow and all of that. Yeah,
Okay.
for sure. Okay, so what if they say that's all the questions that we have for you? What questions do you have for us before we wrap up?
Yeah, so one of my first questions is if the two panelists are there, I was gonna ask like what what brought them into OR, like why they want to pursue OR nursing. And then after they answer that, I really wanted to see if they have similarities compared to mine. Because another similarity that I thought was like a similarity I have is like what I think is cool if they say like it's crazy to see how like we can put a patient, had to go under general anesthesia for a certain procedure and they wake up like hours later like being able to walk again or like, being able to talk again. Like to me, I think that's really crazy. It's like a part of medicine that you don't really see every day. And if they have that, I would try to share like my similarity with that with them. And then my second question I wanted to ask was what is what is the work culture like there at that specific unit? Um, and then the third question I wanted to ask was, as a new grad, what are some notable traits that they noticed from previous cohorts that allowed them to succeed? And what do you expect a new grad to have?
I like that. They're all like kind of standard, but with a little twist.
I wanted to ask, like the nurse retention rate. I don't know if that's good to ask. Like it was like I was like, well, what is? Because I remember like
Honestly, probably don't know it off the top of their head.
oh, okay. Because I was like, what is the nurse retention rate, and what are some strategies you guys have used to like retain nurses?
It's
I
an
feel like
excellent question,
uh,
but I feel like you're not like if there's something that you really need to know, they're not going to tell you. And it feels very like confrontational.
yeah, and it feels like why is he asking that? Is it like do we think he's gonna leave soon? Like I didn't want to ask that question.
Well, it's basically like, does this unit suck? And if so,
Yeah,
what have you done to fix it? Like,
yeah,
are you
yeah.
just miserable? Let me know.
Okay.
um,
Another
yeah.
way to like phrase that more professionally would be like, are there any I wrote it down. It was um what are some major challenges nurses face daily on this unit and how as an RN can I help to improve it?
Possibly. Another question that's kind of similar is like, what do new grads struggle with in the OR, and what have you found is really helpful
Oh, okay.
success or something?
Okay. Are
Like,
there better questions you think I should use instead of the three questions I've asked earlier?
I really liked the ones you had up until the retention.
Oh, okay, okay, yeah. I was not gonna. I think like I thought about using that, but the first two that I asked first, like those were like more my for sure gonna
Yeah,
use.
I liked the first three. So in terms of what they say, sponge it up into your thank you note. Like try to pick like three or four things that they said that you like, that you remember, and
Mhm.
then just build a paragraph around each one talking about how great you think it was and why and whatever.
Okay.
Because it'll be more engaging than just like your standard like thanks for considering me. Here are all the qualities that I possess. Pick me. You know what I mean?
Mhm.
Um, and then you can send me your draft. I can't add stuff to it because I wasn't there, but I can help you kind of craft what you have. And
Okay, for sure.
um, how do you feel about the clinical scenario stuff?
I think I'm. I think I practice those the most.
Yeah. Okay.
Like just from watching your videos and crafting it, like I feel like I'm able to
What do you
really.
think for OR?
The OR is kind of hard to like anticipate in a scenario. Like I think the worst thing to ask is like, what do you do if a patient bleeds out in the middle of like a
Right. That's what I was thinking, bleeding. Or like if you make like what would you do if you know you had made a mistake?
yeah. So first thing was definitely take accountability for what had happened. Communicate clearly with the nurse or like with the team that hey, I made a mistake here, and assess the patient to make sure that they're okay, like their condition isn't progressing, isn't declining, and try to work collaboratively to try and fix the problem, and just learn from their mistakes and really reflect back on the rationales as to why you made that mistake and just prevent it from happening in the future.
You might want to mention filing an incident report.
Final incident report. Okay.
Yeah. Just so that the hospital can look at the system and get a chance to see if there's like a specific pattern that's been happening. Okay, cool. Anything that you can think of that you want to go over before tomorrow?
Mm, I think you really helped me like craft my answers a little bit better. I'm probably gonna go back and look at it tomorrow morning for my interview and like try to like add in like just like craft the perfect
Just put
parts
your
of it.
best foot forward.
And I think I should be ready for this one
Okay.
tomorrow.
Okay, let me know how it goes.
Yeah, yeah, I will definitely shoot you an email. Whatever happens, I will let you know.
Okay.
Thank you so much. Thank you so much for being flexible with me and like
Yeah,
working with
same. It was really nice to meet you.
really love your videos, so just keep doing what you're doing. Like
Thank you.
it really helps out people. All right, have a good night.
Thank you. You too.